Hi everyone, and welcome back to the Chemist Couple podcast with your hosts Lee and Jess. Now, as always, this podcast is about researching the evidence, giving our insight and experience, and trying to provide practical advice for you going forward. So this podcast is ideal for those who are conscious about their health and are just looking to look for reliable sources of information. And as always, this podcast is our opinion, and it's not to be used in substitute to seeing a healthcare professional. Right, it never gets easier saying that, to be honest.
No, it's a long one.
There's no script. So how are you?
I'm not too bad. How are you?
I'm good, thanks.
Now, been in work all day.
Well, yeah, been in work all day. Yeah. One thing we've noticed when we're going back through the podcast is that we actually don't have a discussion as such.
No.
And we did get better. And for those who've tried recording themselves on a mic, firstly, it's quite hard. And then when you do it with a camera in front of you, it adds another form of complexity. So we are getting better, and we were saying last night that we need to make it more of a conversational podcast.
Yeah.
But still give advice. Yeah,
it is really hard. And I think the more and more we're doing, the better we are getting at it. And hopefully the conversation will come with time. But we will try and do that more.
Well, yeah. And what I was going to say was, for anyone watching the video podcast, they may be confused because in the last 3, we've changed location from the hall to somewhere else over there, then here. We are getting 2 rooms done, which we will be using for podcasting, but for the time being, we're trying to find the best environments for lighting as well.
Yeah. So this podcast then is the 3rd in the mini-series for alcohol, and it is to talk about the benefits of alcohol. So I wanted to start off by asking you a question, actually. And the question being, what was your preconception, before we did any research into alcohol, what was the preconception that you had about the benefits of alcohol?
Okay, I mean, mine might be a bit more biased because of our healthcare background, but I always believed that there was a positive effect on some form of your lipid metabolism. That's what you're led to believe.
Yeah.
And that was it, really. I know that we use it in other areas, such as hand sanitisation and all these things that we'll go into.
But as a benefit?
As a benefit, it was mainly due to lipid metabolism. Yeah. What about you?
So, it's funny because the first thing that popped into my mind was that my mum used to work in the hospital. She's a pharmacist as well, and they used to be able to prescribe whiskey and also brandy on like a prescription.
Okay.
Mainly for patients who were already doing it at home, so it wouldn't be someone who'd come in and had never drank before, but it was for people who usually had a nightcap, they call it, don't they, at home. They could prescribe it for the same reason, so to help patients to sleep, to calm them, relax them, which I found crazy. So they actually used to keep whiskey and brandy within the dispensary in a pharmacy. And then the same thing with your heart health. So my mum always used to say to me, if you have a glass of red wine, it's good for your heart, and you know, it can be protective for it. And then the last one is a bit of a random one, but it was my grandma. She actually lived till she was 95, so it was sort of an old wives' tale. And she used to tell me that if I was constipated, to have bitter. And apparently it's the hops in bitter which helps you go to the toilet. I did actually try it one time and it didn't work. So I don't know, you know, obviously, again, it's an old wives' tale, but it's funny how, you know, the benefits of alcohol go back quite far. And you have, you know, everyone has the different preconceptions about what the benefits are.
Yeah, and as we went through the history, it's been around for 7,000 to 9,000 years.
Yeah, and we've used it for so many different reasons, social, religious, you know. So I think that's a good point, actually, is that with alcohol, it's the most widely used drug in the whole world. We're always going to try and find a benefit for it because it benefits us if we find a benefit. So that probably leads us on nicely to what's the research behind it.
Yeah, well, also I wanted to point out that, like we said at the beginning of all this podcast series, that we are going to provide both sides of the story, and we are going to do our best in this one. Mm-hmm. So one of the things I've touched upon already is the use of hand sanitizers. Yeah. Alcohol is good as a disinfectant. It sterilises apparatus, surfaces for cooking, surgical operations, etc. So it does have that benefit. What else was I going to say?
Maybe the social aspect, or do you mean in medicine?
General medicine? It's used as an antidote for methanol poisoning and antifreeze. Yeah. The reason behind that is if methanol is metabolized in your liver to formic acid, and then ethylene glycol, which is antifreeze, goes to glycolic acid, they're toxic, very toxic. Yeah. So if you give ethanol in its place, then it sort of competes with that and it converts the ethanol as opposed to the poisonous compounds. And that's only if the antidote for meprazole is not available.
I was going to say, yeah, so it's only very rarely that we use it. We used to use it as well for general anaesthesia.
We did.
Yeah.
But you try and get a patient up after they've had 6 pints worth of stuff. And that's why we stopped doing it.
Yeah, the kinetics they're not reliable, are they?
No, I mean, you could have 2 glasses of wine, could be fine. I could have 2 and I could be out on the floor and you won't wake me up.
Yeah.
And then imagine trying to get the hospital bed.
Yeah.
When they've finished the surgery.
Yeah. Funny. But yeah, so then that's sort of the medical uses for alcohol. So what about the social aspect? So this was probably one of the biggest benefits that I think first probably comes to mind. If you are a drinker, you think, oh, well, I can socialise and I feel relaxed, I feel more confident when I'm in social situations, and so that has to be a benefit, right?
Yeah, I mean, when I've been reading this evidence, I think this is the biggest impact on your health.
Yeah.
And I don't think it's a direct effect of the actual pharmacology of ethanol. I do think it's the social impacts that it does have. Now, there was a study, I think it was done in Oxford. I have put all the studies below like we normally do. It was done in 2015, and it was basically a survey of those who classed themselves as non-drinkers, moderate, light, heavy, etc. And then it looked at the idea of if you do drink and it's mainly in a city centre and it's infrequent in comparison to a local pub within a community, just to see the benefits of the social impacts of alcohol. Now, one thing you've got to bear in mind is that no one's personality was taken into account. I don't know when the survey was done in terms of, was it after the certain people had drinks or them things. So there was a lot of factors that couldn't be controlled for. But out of 2,200 people, 790, give or take, were non-drinkers or classed as. And on average, well, statistically significantly, non-drinkers were less happy, felt less worth, and they had smaller communities.
Oh, right, okay.
Yeah, so basically, if you don't drink like me, you don't feel happy, you don't work. Yeah. So that was staggering. And then when you go to the idea of drinking in city centres where you're less likely to know the community versus a local, that had positive impacts if you have a local pub.
Right, okay.
So I do think alcohol has its benefits from that side of things, social inclusion.
Yeah, and the sense of community, like you just said before. We've watched, haven't we, the Blue Zones on Netflix, I think, is it Live Till 100 or something like that, the series is called, and a lot of the places that they study, so I think is Korea is one, and then also somewhere in Italy, they're Blue Zones, so they have a high proportion of people living till 100, so centenarians, and a lot of their lifestyle includes moderate drinking of alcohol, but it also includes a real sense of community, isn't it? So whenever they're drinking alcohol, it's often in a social situation. They're often eating a home-cooked meal with family and friends. So, yeah, it could be to do with the social aspect of it rather than the actual alcohol itself.
That's what I believe. But then you look at other cultures around the world. So you look at the Islamic culture. Obviously, there's no alcohol involved there, but they all have a sense of community. They get on with each other and they have positive benefits. But because of the West and its alcohol is a big part of community, that's why it's required. Well, not required, but that's why people feel more obliged to drink. Yeah,
definitely. So yeah, I think with all these studies as well, like you've just pointed out before, they are observational studies, so it's not really ethical to assign. If you were doing a study, you couldn't really say to a group of patients or a cohort of people, drink alcohol every day for the next 9 years, because it's not ethical, because we do know that long-term effects of alcohol, they are there, they are real. So like it is observational, and so a lot of the studies, obviously we can interpret them, but they can be unreliable, and we have to look deeper into them, don't we?
Because a lot of these studies are cohort studies. So I said to you, this is an example of if you had a bunch of pharmacists from 30 to 35 and we look to see the effect of smoking. So we have non-smokers and smokers in that group. Now, we're in the same category. We don't smoke. We're in that 30 to 35. We are completely different in how we would metabolise, process and just general characteristics. We are different. So we can't really extrapolate that data into anything else. But that's what we use for alcohol because, like you said, it's hard to do the gold standard, which is a randomised, controlled, placebo-controlled trial.
So there was actually one that they tried to do, actually, and I was just wanted to point this out before we go into all of the other studies. Let me just see what it was called. So it was called the Moderate Alcohol and Cardiovascular Health Trial. And it was done in America. Well, it was supposed to be done in America. So it was 1,000 volunteers, all above the age of 50, who were at high risk of developing cardiovascular disease. So we'll go on to this. Cardiovascular disease, like we've just said, is one of the biggest benefits to alcohol that is being, studied, but we will get into it.
Okay.
Half of the group was randomised to drink one drink every day for 6 years, while the other was told to abstain from alcohol. Now, it was funded by Heineken. Obviously, everybody knows that Heineken is a big alcohol company, funded by other people, but they were involved in it. So already there was a bit of backlash in terms of, is this going to be reliable? Could we interpret these results correctly? There was actually emails that were found between the founders who were doing the study and also the company, where it was, it was going to be, it was being sort of, what's the word I'm looking for?
Facilitated?
Yeah, or like the results were being skewed and manipulated in such a way. So there was an actual investigation into it and the study was stopped. So with all of these things, again, you have to look behind who's funded these studies, because a lot of them will be, if you've got an interest in it, then, obviously an alcohol company will have a vested interest into trying to get the best outcome from studies such as that. So yeah, that's important to take into account as well. But I just thought, that would have been, it was supposed to be the study to end all studies sort of thing, to like really, it was a randomised control trial. It was going to be the gold standard of being able to determine whether there was a positive impact. But obviously...
And ironically, it was the study that was ended before studies.
Exactly.
Okay.
Yeah, well... So cardiovascular health then, do we want to go into that?
Well, that's the biggest topic, isn't it? It's got a few branches, but most famously the J-curve.
Yes.
So I would say I'd edit it on the screen, but I don't know whether I've got that capability. But a J-curve is, at the beginning, it gives a benefit, and then after a certain point, it goes into a harm.
Yeah.
So the idea being was that 1 to 2 drinks of alcohol per day was as beneficial as 15 to 20 minutes of exercise. That was the original J-curve. Yeah.
It was also that 1 to 2 alcoholic drinks per day was more beneficial than not drinking anything at all.
And that as well, which is quite conflicting how evidence has moved on. Yeah. Even within guidelines, so the World Health Organization, the Department of Health in England and the UK, they've changed from, they don't use safe drinking guidelines, it's low risk drinking, because they've alluded to the fact that it's quite hard to determine that.
So actually, I think that study, I was just reading up then, that came about after the one that I've just mentioned. So after this whole debacle about the cardiovascular health and Heineken being involved, the Global Burden of Disease study published a study, and it was the most comprehensive study that's ever been done. Again, it was an observational one in terms of it was collating all of the other studies, so it was over 700 studies that they actually used. Okay. And it concluded that the safest level of drinking is none. And then the World Health Organization adopted that, so that's probably where this has now come from. But if we rewind back, for many years, the J-curve was something that we definitely did look at, and it was something that was used to determine the amount of units that we should be drinking. And
it's one thing that's still not being debunked today. Yeah. So we have tried to account for misinterpretation and definition of categories. So previously you had, when you do a controlled trial, for example, you categorise non-drinkers. Ideally, they should have been people who have never drank at all. So I wouldn't fit into that category because I have consumed alcohol for 8 years or give or take. But in this category, they classed lifetime abstainers as those who were called sick quitters. Yeah. So those who quitted because of poor health. Yeah. So straight away, they're already at a disadvantage to those who are moderate drinking, because they're probably more conscious of their health. Yeah. And that's one of the things. So the study I looked at for the J-curve, because it's been updated and there's loads of studies. So there was one from 2023 and it was a US population study. Again, it was a survey, so they sent it out and it was all to do with, what do you class yourself in terms of drinking. So it was down to the person to report what level of drinking. As we've known through our own experience, drinking is still underreported. Mm-hmm. So again, that's got a potential to skew results, but it come back, I think it was about 900,000 people anyway. And at the end of it, they'd done a retrospective look at the study and the data of how people died, etc. And there was a benefit on paper for those who drank light to moderate amounts in comparison to non-drinking. Yeah. Yeah. But trying to remove that bias and to remove all the confounding factors is really hard because it's all down to patient reporting, it's then down to definition. Now there is studies that they say that they've removed this idea of miscategorization of patients and public, but it's hard.
Yeah, it is. And the mechanism behind how it works, or how it's supposed to work, is that it's supposed to increase your HDL levels, isn't it? So we've actually done a podcast on this previous, which was a cholesterol podcast, so you can go back and watch that or listen to that. Actually, it wasn't recorded by a video, but yeah, so HDL cholesterol is classed as good cholesterol. Now we can't actually class it as good cholesterol anymore, so I think there has been studies that have been done where, again, they're observational studies, but it was using Mendelian randomization, and it basically just uses genetics as well as other lifestyle factors to determine whether it's causation or correlation between, an outcome, basically. And anybody who had high levels of HDL, they didn't have a decreased risk of cardiovascular disease or all-cause mortality, whereas people who had a decreased level of LDL did, and that's just purely down to genetics. So even if alcohol is increasing your HDL level, it doesn't suggest anymore anyway that is protective for our health. We also know that alcohol increases the risk of bleeding, by it basically prevents blood from clotting. If you think about in the arteries, when you do get buildup of cholesterol, it's a prothrombotic environment, which it increases the risk of developing blood clots. It's thought that alcohol decreases this risk in some way, and that was sort of the basis behind why they thought it did help with cardiovascular disease. Yeah. But we do know that it does increase blood pressure in the short term, which obviously is not as beneficial to cardiovascular disease or heart health.
But it can cause vasodilation.
Yes.
Which is
initially, can't it?
Yeah.
So it's very complex in the science behind it, but I think as a rule of thumb, the J curve definitely needs to be taken into consideration that there are factors that may not have been represented within the study.
Yeah, I think the biggest thing that other studies have tried to prove the J curve wrong. Yeah. And when they've done this Mendelian randomization, etc., it has proven that there is no benefit for alcohol at any concentration. And when they looked at the stats of why these J curves may still show a benefit, is because, like I said before, you are more likely to have better health than someone who's a sick quitter. Yeah. You still drink, you do it moderately, but then you look after your health in other ways. You're physically active, your diet's really good. So that's a potential. There's all these...
I also wanted to point out as well, so this was a good example I felt, was that you would be in the abstainer category. Now, obviously, we know that you have drank previous, but you would have been in that category, whereas one of the reasons why you stopped drinking was because of your family history of cardiovascular disease. So it may be that you automatically have just been dealt, genetics that increase your risk. And so, do you get what I mean? I think that's a good example of someone who would be in that category, but maybe at an increased risk already, but just purely down to genetics, not lifestyle factors.
I know, because I did look into HDL cholesterol, the good cholesterol. Same thing, there's no such thing. Yeah. But when the study was really in depth, it had about 15 pages, so I lost the will to live towards the end of it. But they did show a modest increase in HDL. But like we said in previous podcasts, HDL works, it can transport the cholesterol from your cells back to the liver in two ways, directly, which I didn't know about, but it does have a direct route on a certain receptor. I don't know the name of it. Yeah. And then the other way is that it converts its cholesterol to LDL and VLDL particles, which is the bad cholesterol, through an enzyme. And then it's up to them to go back to the liver through the receptors. Yeah. So if you're increasing HDL, you are increasing the chance of it going to LDL, which is the bad form. So that's probably why after a certain point, you're saturating that process, which could decrease cell turnover of cholesterol. Yeah. But looking at the evidence as a whole, it's hard to say what's a benefit and what's not. Yeah. I do think, going back to the social aspects, I think that's a positive one in terms of if you are going to be lonely and not drink. I think there's a lot of evidence at the moment now where if loneliness can be just as bad as any other condition out there. People die from broken heart syndrome. Yeah. It is an actual physiological reaction that does happen. And I think if one drink is going to enable you to be in an environment where mentally stimulated, you're happy, you're laughing, because that's what alcohol does bring along with it. The lack of inhibition does allow you to open up more. You know, it does happen.
Yeah.
And then if you're comfortable within this environment, you create a community. Whether that community is a true community in terms of if you didn't drink, that's besides the point. But if you're involved in something and it's got them benefits, it could be more beneficial to you than what it would be for me.
Yeah, no, I agree. And I think obviously just to go back to last week's podcast, the units that we do suggest is 14 units for men, 14 units for women over at least 3 days of the week. So not, on a binge drinking and drinking all your units at once. Obviously we know that, I wanted to point this out because I feel like this is what the government guidelines tell you. However, if you do read more into it, the guidance also says that there is no safe level of drinking alcohol, and I think that there's a misconception that, because we do trust the government a lot of the time and hope that they're doing the best for the population, and sometimes then they do get it wrong, and I think that people need to understand that as of right now, the safest level of drinking that the government do suggest is none. Although if you are going to drink, they say to not drink any more than 14 units of alcohol. And I think from doing this podcast, for me personally, it's been interesting, it's been educational, because I still do drink. I don't drink as much as what I used to. I probably, I drink in a social situation. I usually have a red wine with a meal, something like that. But it's made me question whether I want to continue, because at the moment, alcohol is probably the only thing in my life that is considered unhealthy. I've really changed my diet, which is really good. I have a good exercise regime. I can practice yoga and meditation to, reduce stress levels, although that is definitely something I need to work on still. But other than that, alcohol is the only thing. And so it's been really interesting for me. And I like that, me and you are obviously in a relationship, and you don't drink and I do. And it's funny how, different people have different risk evaluations, or we evaluate risk in different ways. You've decided for you that alcohol is not beneficial, whereas I've decided, well, I still like going out and socialising with alcohol at this moment in time.
Yeah, I was going to say with alcohol. I do still go out.
Oh, yeah,
I'm not stay at home.
It's been something that I've thought about for a while, do I stop, do I not? And it's just been interesting to research it, to see, are there any benefits? And I also think it's good because from a point of view of someone who does drink, I feel like I have tried to clutch onto the benefits more than you have. Whereas I've said, I've read this study and it said it's really good for your heart health, or there was one study where it said it reduced your risk of ischemic stroke by up to 50% if you drank up to, I think it was 4 units of alcohol a day. And so I've tried to hold on to that, and it's, in the grand scheme of things, we know that drinking to high levels of alcohol, drinking during pregnancy and binge drinking are bad for you. It's this moderate drinking that we're trying to, figure out whether it's good or not. But I think it's just been so interesting.
It is, because when you set your heart on, so when I stopped, I set my heart on everything to do with alcohol is bad from a consumption point of view. One thing I haven't touched upon, by the way, is the use of medication.
Oh, yeah.
Because that's important, because anyone who's got children out there, and the most common dosage form is liquid. Yeah. And a lot of liquids in children's medication involve ethanol. Yeah. So the reason why we do include ethanol is because its ability to be a co-solvent. So the idea is, for a drug to be absorbed, it needs to first be dissolved within the gastric fluids and the intestinal fluids, and then it needs to be absorbed across a membrane. To do that, it's quite weird, because a drug needs to be aqueous soluble, meaning soluble within fluid, and then it needs to be fat soluble to allow it to cross the membrane. Yeah. I'm saying this to you, you won't know this on conversation, sorry. But ethanol has that ability to dissolve within fluids, but then also cross barriers and membranes. Yeah. So when we take a drug that's not soluble, I'm trying to think of one. Frusemide is used a lot, but I don't know about its solubility. But frusemide is one example where we use it with a high concentration of ethanol. We've got phenytoin, paracetamol in some formations do have it. And the idea is it dissolves the drug, and then it can lead to therapeutic levels quite quickly. But when I looked at the concentrations are really high. Yeah. So on some of them, it was in comparison to a glass of wine, which was more, just over a medium glass of wine, which is about 210 ml. And you could do decent fractions from that reference point. So some of them might have been a sixth or a fifth during certain dosing regimes, and they without even knowing.
Yeah, no. Well, from a pharmacist's point of view, if you are working in paediatrics, you definitely will know. And so, if you've got, usually the medications are used under specialist supervision anyway, like liquid furosemide is a special, isn't it? So
it is specialist through hospitals, but I just wanted to bring it to people's attention from a religious point of view as well.
Yeah, but if you like your pharmacist will know that, and when we're in university we do get taught about concentrations of ethanol in certain drugs and just being mindful of it. But it's one of those things again, and it's a risk benefit, and it's like that with everything in medicine. What is the biggest risk to somebody's health at this moment in time? Like you say, it could be that if someone's very lonely, the biggest risk to their health is dying of loneliness, and so then drinking is a benefit to them. So then their risk benefit, is that, okay, well, I'm going to have a drink because it's going to be beneficial to my health. Yeah. And it's the same in medicine all the time. Like, that's constantly what we do in our job, is we do a risk benefit to a patient a lot of the time, because any drug comes with side effects. So alcohol is a drug, it comes with side effects, and you just have to weigh up whether it's worth it for that patient or not, and whether that patient accepts those risks, in comparison to what the alternative would be if they didn't have the drug. Yeah. So yeah.
That was a good summary.
That was quite a good actually.
But yeah, like before I went off onto the paediatric formulations, when I stopped drinking, I did look at alcohol as a negative thing. Yeah. I still do in some aspects, so that's why it's quite good to do this podcast, because this podcast today, I did look into the benefits, to do it holistically, to give everyone the evidence that they need. Yeah. And then when you look at certain studies, I'd be like, okay, it's the worst thing on the planet. And then you'd see studies like you've said, that the benefits of cardiovascular disease, then you're conflicted then, because I've got a poor history of cardiovascular disease in young men. Mm-hmm. Should I go back to drinking? All them things go through your brain, and it's weighing up each individual patient. In my opinion, at the moment, there's no benefit to me. Yeah. But looking at this, without alcohol within medicine, we would have a lot of, we wouldn't be as advanced as we were. Like I said, formulations of medication, you've got hand sanitizer and sterilisation.
Mm-hmm. The fact that we were able to use alcohol for general anaesthetic, before that, what did we do? When we were performing surgery, patients were awake, which is incredible. Like, it's insane, the amount of pain that people must have been in. So it has had its benefits over time. Yeah.
And I think, to summarise the whole, this podcast anyway, take home points of the benefits of alcohol. Socially, if you are in a Western culture or a drinking culture in society, it does have benefits. It removes that idea of exclusion, loneliness. So I do think it has its benefits there, but that must be weighed up against the physiological effects on the liver, cardiovascular wise, until there's more data out there. Yeah. The J-curve is there. There's proof that there is some sort of benefit. Whether they've been manipulated, I can't comment on. Yeah. But there is benefit on paper.
Yeah. The only thing I would say about that is that, you get a cardiovascular benefit from alcohol. It's also maybe to do with the polyphenols in it, which are the tannins and the things that give it its colour. So red wine is made from red grapes, and they have, polyphenols in, which can do a lot of things, but, they reduce inflammation in your body, which, they can also quench reactive oxygen species. We do know that alcohol does produce them. So again, it's conflicting evidence, but the point is that you could reduce your cardiovascular risk by other means. So you don't have to do it by alcohol. So you could eat a very colourful whole food diet, which is probably going to have a beneficial effect, better than alcohol. And it won't come with the negative effects that alcohol comes with, that we discussed in the last podcast. So, it's all, again, about just weighing up.
Yeah. And I'm not advising anyone to start drinking if they're not drinking, by the way.
So this is this is definitely
purely advice. Bringing, referring to certain studies, making people aware of what's out there. It's also not to tell people to stop drinking, because if you are a constant drinker, a chronic drinker, if you want to call it that, it can be harmful to stop abruptly. Because you get withdrawal, so you should always do this under management. But I just wanted to bring that up there in case anyone did.
And I think the last point as well is what we have already said this, but at the moment, the government say 14 units a week for both men and women, but they also do say that there is no safe level of drinking. I think that's just important to bear in mind, because I didn't know that, and I was under the assumption that oh, you know, if I drink 14, I don't drink that much anyway, but if I did, oh, it's fine. And actually, when you look into it, well, actually, it's probably not, you know, and it will be detrimental to your health. But it's completely an individual situation, and you have to weigh up your own risk and your own benefits. And that's why we do these podcasts, so that we can give you all the information that we know that's out there, so then you can go away, digest it, and then decide, well, what is best for me and my lifestyle.
Yeah. So in a short format and answer, do you think alcohol has benefits?
I do in moderation, but I think it's very difficult to drink in moderation when you're in an environment that promotes drinking. So it's definitely made me think about what I'm going to do going forward with regards to drinking alcohol.
Yeah.
And what about you?
I think it's got benefits socially, and depending on who you are as a person and what matters most to you, because that's what life's about, what's individually the most important thing to you. And if socialising is your highest priority, then it is unbelievable. If you're in that culture, obviously if you go to a group of people that don't drink and you're off your head with alcohol, it's probably not the right culture for you. But yeah, I do think it has its benefits, but it should be individualised. Now, next week, we have got the last one, which is about medication. And it's mainly to do with how alcohol interferes with some common types of medication and what you should look out for. So one of them is paracetamol. We'll go into maybe blood thinners and antibiotics, a big one.
I feel like it's one of the most common questions that I ever get asked from my friends and family is, Jess, can I drink on this medication? So we thought we'll go through which medications you can and can't drink on.
Yeah.
Basically.
And as always, thanks for listening, and we'll see you next time.